Hi, my name is Chloe Hiles. I'm a student PTA at Penn State Hazleton. Can I have your name and date of birth? Can I work with you today? Do you know where you're at today? And do you know what day of the week it is? Okay, great. So I understand that you've been having some issues with your right hamstring. So today we're going to just do a treatment. It's to just relax the hamstring. You shouldn't feel any sort of pain, prickling, like shocking feelings. If you are, please let me know because then I will turn down the machine or I will stop treatment.
Alright, so how are you feeling now?
So I'm just going to palpate your right hamstring just to see where the pain is. Can you point to it first and show me where it's at?
Satisfying feeling?
Right here? Okay, so what you say it's about right here? Okay. So, and see that her sensation is all in check, as well as her mentation, because I'm talking to her and she's not having problems. How would you rate your pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain?
Okay, so
1? Okay, well that's good. Can I...
I'll help you out here.
What, have you been having problems with any of your activities that you've been trying to do lately, like driving,
Walking around my house and going up and downstairs.
Okay, and can you just kick your leg out like that for me real quick? Okay, so now I'm just going to test your temperature just to make sure that you have all the feeling there. So I'm just going to test it on your unaffected leg first. So this is cold and this is warm. Okay. So I'm just going to have you turn your head to the left and close your eyes, and I'm just going to test the area that I'm going to give you ultrasound today.
Cold.
Nice, toward the other way. Now,
Cold.
without rotating, you're just going to lean your body forward.
Cold.
Good.
Okay, great.
Towards the other side.
So your temperature and sensation is all in check.
Any pain?
So I'm just going to go through a couple questions for you. She has no anesthetized skin. She has no current bleeding in the area since I looked. Do you have any arterial circulation issues? You're not pregnant? Do you have any cancer in the area?
Nope.
Have you ever had a laminectomy?
Nope.
Do you have any sort of infection in the area? I will not be performing it over the carotid sinus or cervical ganglia or over her eyeballs. Do you have any blood clots?
Nope.
And do you have a pacemaker?
Nope.
Okay.
Yeah, like sometimes it comes down all the way.
Alright, so now I'm just going to have you come up on the table. I'm going to have you lay on your back. And you're going to put your head this way.
Gentle stretch at the back. If this becomes too painful for you,
Where was the pain again? I'm going to have you lay on your stomach.
table
Thank you.
like this one, and you'll be with your knees up like this. And
Okay, so now I'm going to turn on the ultrasound machine.
you're going to place a towel
Yes.
under your lower back
And here.
and try to press that towel
Both sides.
into the table.
So I'm just going to map out her ultrasound area
Back down.
once I get this tube open.
Really what's moving is your pelvis, but this is going to give you a little bit of range of motion in your lumbar spine and a little bit of a stretch. So I'm just going to have you demonstrate this one here. This is probably the safest, so we'll have you do this one. There, you can come off the chair. We're just going to put you on the table here.
So this is the area of pain, right? Yeah. Okay. So I'm going to map out the area with ultrasound gel.
Yeah. Okay, so go ahead and press that down into the table. And then back up. Good. Any pain?
0 being worse.
Okay, you're going to do that and try to hold it for 30 seconds in each direction.
Okay, probably about
And if you have any pain, please stop.
It's going to be cold, sorry.
And do you have any other questions? Alright, sir,
I'm going to map out 2 ERAs of area.
So, sorry. I'm just gonna have you get on the table now.
So I'm going to go deep. So I'm going to set the duty cycle to, or the frequency to 1. The duty cycle is going to be on 100% because I will do thermal. And the treatment time will be 19 minutes. And I will be setting the watts to 1.5. We're going to build up to that. We're going to start at 1. So I'm going to start the treatment now. Do you have any questions? Do you have any questions?
No.
Okay. If there's any pain or prickling, please let me know, because that's not a normal reaction. This should feel like nothing but the ultrasound head moving, okay? All right, and now I'm going to be starting treatment.
Bring it up just a little bit higher. Okay.
really worry about that.
And now I'm just
What
gonna
exam?
count this one.
Okay. How's that feel, Cheyenne?
Good.
And I flatten the area to get rid of any bubbles. Okay, now I'm going to turn the machine up to 1.5. It's 19 minutes because it's 2 ERAs. How's that feel, Cheyenne? Do you have any pain?
No.
Okay, it's been 19 minutes, so I'm going to conclude Cheyenne's treatment. I'm going to turn the ultrasound machine
I'm
down,
just gonna type this.
and I'm going to stop
Type in
treatment
this, so just gonna-
while keeping the ultrasound head moving. Okay, the machine stopped. How do you feel?
Good. Very snug?
Yes.
Too tight?
No.
Okay. And then for this next one, I'm gonna crisscross these, but I'm gonna ask.
Okay, I can see that her skin is still intact. There is no active bleeding. Her skin is all clear. And I'm just gonna have you do one final thing, Cheyenne. I'm just gonna have you sit up on the edge of the bed for me.
Yes.
And I'm just gonna have you kick your knee out like this and bring it back in.
And now I'm gonna hook.
And bring it back in. I'm gonna have you go out and in.
And then I'm just
And
gonna pull on
do you have any
it to make
questions
sure
for
that
me?
it doesn't
No.
slide.
Alright, well that concludes treatment. Do you have any questions?
Be tightened a little bit
All right.
more.
If when you're doing this at home, you can use a hot pack. You can get ones that heat up, or you can use 4 to 8 layers. Get a hot pack and put it on your skin for 20 minutes. And that concludes treatment today. Thank you for letting me. Thank you for working with me.
You're welcome.